Hello everyone, good evening. This is an important topic we're going to see at the topic of intracranial hematomas. And before we go get into the topic proper, we need to understand what are all the layers that we are basically looking at. So you know that basically, so let's say for example, this is your pericranium, and you know that you have got scalp here. So P for pericranium. And just beneath the pericranium you have got, of course, you have got outer table and inner table, two tables there. Then beneath the pericranium you have got meninges of the brain. So here it is your meninges of the brain. And as you can see, this is your brain parenchyma. So let's say for example you have brain parenchyma here, and these are your layers, nothing but your pia matter, arachnoid matter, and dura matter. Okay, yes. And as you can see, this is your beneath the dural. So this will be your subdural space. This is your subdural space. Whereas this one is your extradural space. This is your extradural space. And you can see this is your arachnoid matter and this is your subarachnoid space. Subarachnoid space, right? So what are all the different layers we have? What are all the different vessels we have at each space? So depending upon what type of hematoma, which vessels are involved means, let's say for example, usually in subarachnoid space, your circle of Willis will be going. So here you got circle of Willis. Okay. Then in the subdural space, usually we have got emissary veins or something like your bridging veins. They're called bridging veins or emissary veins. So here you got emissary veins or bridging veins. All right. Then in the extradural space, usually we have artery, mainly arteries involved. Sometimes in around 15 to 20% you can have even veins also. So you have got again usually middle meningeal artery slash middle meningeal vein. So what is this? Middle meningeal vessels. Middle meningeal vessels. Okay. So if you have this basic anatomical background, now let's look at what are all the different intracranial hematomas we have. So we will see. So you know the most common three important things, and of course, whenever you have bleed occurs here within the brain parenchyma, that is your intracerebral hemorrhage. This is your intracerebral hemorrhage. All right. Now, so let's look at what are all the different most common hemorrhages that we encounter clinically. So as you can see here, it is a hyperdense. So these are all nothing but your CT. So CT axial view. Okay. So as you can see from here, mainly this is your biconvex shape. As you can see in the picture, this is something like a biconvex shape, or which is also called lens shape. So it is your biconvex shape or lens shape. Okay. This is seen in your extradural hematoma. Now, as you can see, this is the course of the hyperdensity we see here. So it is nothing but your crescent shaped, or it is also called concavo convex. Concavo convex shaped bleed. All right. Then here, usually I told you this is your subarachnoid hemorrhage. What vessel is there in subarachnoid space normally? Circle of Willis. So that is the vessel you have here. So whenever there is hemorrhage occurring in the subarachnoid space, usually it will take the shape of circle of Willis. So as you can see here, this is something like your circle of Willis. So this is your subarachnoid hemorrhage. Sometimes Let's say, for example, only when the hemorrhage is occurring within the basal cisterns or something like that, it may take different shape of the bleed also, or it can take even little bit different kind of a hyperdensity like this. Okay, so this is regarding your subarachnoid hemorrhage. So biconvex shaped or lens shaped hemorrhage is seen in extradural hemorrhage, and crescent shaped or concavo convex shaped is seen in your subdural hematoma. And it can take either the shape of sarcophagus, or it can be something like within the parenchyma, that can be your subarachnoid hemorrhage. Now, what are the other different types of hemorrhage means? As you can see here, it's a hyperdense lesion within the parenchyma of the brain. So it is inside the brain. So it is nothing but your intraparenchymal bleed. Now, this black color is your nothing but your CSF. Okay. So that is nothing but your CSF. So whenever hemorrhage is occurring within the ventricular system of the brain, that is your intraventricular hemorrhage. Okay. Then, so these are all the three things that we have already seen. So as you can see, this is not taking the shape of entire circle of Willis. Only when there is only cisterns filling, then it can take a shape of similarly like this. So this is your subarachnoid hemorrhage. This is your subarachnoid hemorrhage. Okay. Then this is again we have seen already. This is your crescent shaped bleed, or it is also called concave or convex shaped bleed. So it is nothing but your subdural hematoma, right? Then this is your biconvex shape, or this is also called lens shaped hemorrhage. Then some people refer to the fruits also, like this is your lemon and this is your banana. Okay, so usually this is banana and this will be lemon. All right. Then usually you know that subarachnoid hemorrhage can be mainly most common cause of subarachnoid hemorrhage nowadays is most commonly trauma. Otherwise, it can happen secondary to rupture of aneurysms when in case of uncontrolled hypertension. So, whenever you have got a uncontrolled hypertension, there can be berry aneurysms. So, these berry aneurysms can rupture. Usually, these berry aneurysms are present in nothing but your circular Phyllis again. So where is circular fill is present? Again, subarachnoid space. So what type of hemorrhage it will cause? Subarachnoid hemorrhage. So whenever patient has got uncontrolled hypertension with berry aneurysm, when there is rupture of berry aneurysm, it can cause subarachnoid hemorrhage. All right, right. So again, so subarachnoid hemorrhage can be due to either trauma or because of this berry aneurysm rupture. Okay, right. So epidural hematoma is usually seen again in case of bikers. And you know where is the most common site of epidural hematoma? It happens at a place called terion. It is the weakest part of your temporal bone. Okay, right. Then subdural hematoma is little bit bad because there is something called coup and counter coup injury. So as you can see here, so usually whenever there is impact on one side, it can also cause the impact or damage on the exactly opposite side of the brain. That is called your coup and counter coup injury. Coup, counter coup injury. So this is more common in case of coup, counter coup. This occurs more commonly in case of subdural hematoma. Okay, whereas epidural hematoma has got a characteristic phenomenon which is called lucid interval. Okay, so your epidural hematoma has got lucid interval. What do you mean by that? So whenever a patient has got epidural hematoma, initially patient will be awake or something like initially the patient will be losing the consciousness. There will be LOC initially, but again patient will be coming to awakening state, and after some time again patient loses consciousness. Okay, so whatever this period of normal consciousness between two episodes of your loss of consciousness, that is called your lucid interval. It's a very dangerous situation. That is why whenever you come across epidural hematoma, patient must be admitted and should be treated accordingly. Okay, all right. Then you know that what is the most common tool we use clinically whenever we got any head injury. You know that it is nothing but your GCS. So Glasgow Coma scale. So based on the Glasgow Coma scale only, you will categorize what kind of a head injury is, whether it is minor head injury, mild head injury, moderate or severe. And depending upon GCS only, we will prognosticate. So we can decide the prognostication or prognosis of the patient depending upon GCS. So the other thing you need to remember is that usually subdural hematoma. So this is your epidural hematoma. This is outside. This blue color structure is nothing but your dura mater. So outside the dura mater is nothing but your epidural hematoma, and subdural hematoma is beneath the dura mater, that is inside. Okay, then this is occurring within the brain parenchyma, that is why it is your intracerebral hemorrhage. Again, if it is something happening at the level of cisterns, that is your subarachnoid hemorrhage. All right, so this is about briefly about intracranial hematomas. Thank you.